Hello, Don here. Welcome to Podiatry Practice Mastery. We're trying to help you get your practice to the $1 million mark and beyond. I'm gonna go over a question today. There was a doctor that asked, well, what are practices pulling in $750 to $1 million per provider actually doing differently day to day? Is it a specific services, better systems, smarter scheduling, or something else entirely? Because from where I'm sitting, I can't figure out how they're hitting those numbers. Now, this is exactly why I put together my $1 million practice formula. So if you are listening to this, you have this question, go to there, get the free version, the first couple of steps, and then do the paid version. It is certainly worth it to help you. But I'm going to go over high level. So high level is you have to have your schedule filled, number one. So filled to me is about 25 patients, 20 to 25 patients a day. That is filled, okay? You don't want super busy days, but if you can fill your practice, let's say 20 patients a day, at $200 per visit, that's $4,000 a day and then $80,000 a month, which brings to the $1 million mark, okay? If you see more patients, then you'll make it there easier. If you have a lower per visit value, that makes it a struggle. So if all of your visits are like $75 or $100 or routine care, you have to see double the amount of patients, which is really difficult to do. So my main thing would be see less patients, have them get more per visit value, okay? Second thing would be services. So once you are filled up, so once again, if you're not filled up, the number one thing is to get filled up. If you're already filled up, then you want to separate what's profitable and what's not profitable. So what's not profitable tends to be routine care. So I put those all on a half day, double booked, and that's the only time they can come in to see me. And then I also have non-profitable, like quick follow-ups, things like that. I put them in 10-minute slots. So they're kind of double booked around the more profitable 20-minute slots. Okay? And that's the second thing. Third thing would be to add, once you do that, then add services. So services are certain other things that you're not currently doing that can bring in more revenue. Now, I'm assuming you're already doing x-rays on every patient that needs it. You know, staff automatically do x-rays instead of you having to ask every time. I'm assuming you're already like doing in-office procedures, you're already doing other things like that. But packages, so services would be adding some additional services, such as imaging, such as ultrasound, such as shockwave, such as in-office dispensing, products that you actually will provide to patients, durable medical equipment. If you're not doing durable medical equipment, you have to do that. Orthotics, you have to do orthotics, okay? And then a part and parcel of services would be packaging things. I think packaging things makes it a lot easier. So for example, when people come in for nail fungus, they're going to get a UV light shoe spray and a biotin. So that's a kit. I call it the fungal kit. That's $200. Every single fungal patient gets that, whether they do laser or the oral, okay? For me, another kit they get is the night splint foam rolling and morning stretch. So that's what I do for all my Aquinas patients. It's called the Pelto special. So everyone is getting dispensed either 1 or 2 night splints based on unilateral or bilateral, and then they're getting the foam roller they're purchasing. Okay, and then we teach them morning stretch. Also, all of my shockwave get 6 shockwave, and at the third one is where I scan them for orthotics. So that's called my shockwave package. I get packages. My laser have packages also of 6 laser sessions. So these are packages. So the more you can make things into packaging, it makes it a lot easier for patients to just say, yes, I want that package. Okay. I kind of went over this before, but having your imaging automated. So I know a lot of doctors say, oh, we're going to ask for x-rays. If x-rays aren't done before I get in the room, I very rarely do them on that visit. I'll have them do it the next visit just because it takes too much time. So all my patients are going to get x-rays with foot pain. Even if it's a callus, my patient, they say foot pain, they're going to get an x-ray because a lot of times there can be a bony prominence underneath or something else like that. So tons of x-rays. Ultrasounds, I do it the same day, have them just ask for the ultrasound to bring it in. So having your imaging automated. And then the last thing would be having your durable medical equipment, kind of your protocols. So the most common things we use for like foot pain would be like a cam boot, would be night splint, would be all these other types of DME items, and then doing custom DME. We do some of that, doesn't bring a ton of revenue, but these constant things that come in like ankle braces, night splints, cam boots, things like that, they can really boost up the revenue. I personally, what I do is I have a daily tracking sheet. So if you want my daily tracking sheet, shoot me an email, don@podiatrypracticemastery.com. I like to track these things. So what I track is I track the age of the patient, what I did, what package they did, if they got in-office dispensing, if they got imaging, if they got DME, if they got procedure, and then the follow-up. I didn't mention procedures, but a lot of my patients get procedures, okay? And I guess the other thing I didn't, like the elephant in the room is, I didn't even mention this, and I haven't mentioned this for a while, but opting out of bad insurances. So if you have insurances that don't pay, you have to kind of opt out of those. Just like say, okay, we don't take free care, we don't take Medicaid, we don't take Mass Health, we don't take these types of things. So those are kind of the things that can bring you to the $1 million mark, okay? Second question I got here is I want to add cash services like Shockwave, but the upfront investment scares me when my margins are already tight. How do you realistically evaluate whether new technology will pay for itself in your market, and what did the math look like for you when you made that leap? So I have an Excel spreadsheet that if anyone wants it, you should just shoot me an email and ask, hey Don, give me your how do you it's called it's like an Excel spreadsheet where you can put in how much the technology, either the EMR or the shockwave or the ultrasound, how much it costs, how many patients you have to do to make it break even. Or you can just find this on, if you Google it, you can make your own, but it's pretty easy to do in ChatGPT. So I use my calculator. So ask me about that, Don at Podiatry Practice Mastery. I will be happy to send that to you. Number 2 would be just ask a rep. So find a rep and say, hey, would you mind dropping this off so I can try it? So we had a shockwave, the Softwave, by the way. He dropped it off for I think 3 months or 6 months, and we were just using it for free because we didn't have a non-radial device in one of our office, and we were thinking about buying one. And he's like, hey, you can just try this. And so we used it, and we actually we used tons of shocks. We were charging for it, and when it was about ready to change the cartridge things that you have to change, he's like, okay, when yours comes in, we'll bring it in. And they just swapped out. That was like a trial, a demo one. So that's called, if you know it in sales, it's called the puppy dog close. So really, they should be giving you these things. You can try them out, make sure that you can explain those to patients, make sure patients get good results, and then you can do it. It's the same way the rep would give you samples of stuff. They should give you a sample. So that would be my second idea. And the third would be to find a doc who has that technology and shadow them. If you aren't interested in shockwave, come and see me. Come to my office, spend a day. It's going to take me out of my practice. Well, that one day out of your practice is going to make you so much more than constantly sitting on the fence about doing these, or even just go to a conference. So if you don't want to see a visited office, go to a conference. And then finally, really for most of these technologies, all you need is one package per month to make the payment. So for example, if you're going to do Swift, you're going to do Shockwave, or if you're going to do any of these things, let's say the payment is $500, $600, $1,000. Well, if I do one Shockwave package, that's $1,500. If I do one Swift package, that's $1,000 because it's four treatments. So all these things, you have to think of how many you need to do to pay it off. How many ultrasounds do you have to do at cash pay? Do you have to do that payment? So if you can do that, all the rest is gravy for you. So those are some ways of thinking about how to incorporate cash pay services into your practice. Okay. Once again, if you guys found this beneficial, let me know. And also, I would recommend you going and downloading that $1 Million Practice Formula. There's a free portion, then there's a paid portion afterwards. But really, I explain everything in there on how to do these things.